Thank you.
No worries. Mary, it's all yours.
So, Mikey, thank you so much for being here today. When we set this session up in January, life at hospitals was complicated, but now it's doubly complicated. So, you're a very brave person because there are so many very recent issues that really put the pressure on both cost and waste side, with both pandemics and budgets, research, everything that's just tumbling in. Mikey Pasciuto is the Chief Sustainability Officer at Scrapp, a startup he co-founded to create data-driven sustainable waste programs. A graduate from the University of New Hampshire with a dual degree in mechanical engineering and sustainability, Mikey has studied and worked on a wide range of systems projects on several continents and recently had the privilege to present to His Majesty the King at COP28 as part of Scotland's delegation. Mikey also serves as the president of Collaborative Solid Waste Strategies, a nonprofit dedicated to promoting sustainable waste management in New Hampshire. I read a bit about Mikey, and I think one thing I read that I really love that I think can be an inspiration for us all right now is that he wants to keep purpose and passion linked in whatever he does. So thank you, Mikey, and it's all yours.
Of course. Thank you so much for the introduction. So, as everybody now knows, I'm Mikey. I'm one of the co-founders here at Scrap. I like to joke, I'm just a guy that is very passionate about trash. That is kind of my thing. The running joke in the family is my sister is actually a missile scientist, so I compete with an actual rocket scientist. And my dad jokes, he was like, she blows it up, he cleans it up. It all comes full circle, so everything's fine. Um, so just before I got started, I'm gonna put a link in the chat. If anybody is in a hospital setting and needs help with in terms of going zero waste or in a facility or business, that's my job. So if you use that link, you get into contact with me. But as far as how tonight was going to go, I do have a presentation slide set up. Um, and I'm happy to step through it, but I more or less prefer more of a dialogue going back and forth. So at any point, stop me and ask questions. I just figured I would step through zero waste in hospitals, the different aspects of waste that there are. Also, what is zero waste? Anybody want with a raise of hands? How many people feel very confident that they're zero waste, experts or aficionados, or more or less want to learn something new? And I know we have students here, so I will start from the bottom and then up in terms of the presentation so nobody gets lost. But other than that, I'm happy to share my screen and just have us get started. So, as far as what we do, as far as zero waste and modern healthcare, figured to introduce myself first. Honestly, the introduction was fantastic. I am from Boston, the greater Boston area. I'm from a small town called Burlington, well known for the mall. And students that are younger, maybe you would know Paul Blart Mall Cop that was filmed in our town. For the older crowd, Amy Poehler is actually from Burlington, is along with Steve Wright. So something definitely in the water here. I went to UNH, graduated in 2021 with a dual degree in mechanical engineering and sustainability. During that time, I also studied in Iceland and New Zealand. So I got my stripes in to study abroad. I used to work in precision manufacturing, as far as manufacturing aerospace components. That is what I'm classically trained in. And then I went on to do high-speed cable development. So I developed cables that could transmit data about 112 gigs a second. And then at the end of all of that, I decided to go into waste, and I am now a true waste advisor, which is our certification for being very, very knowledgeable about waste. A little bit about the problem we face in the waste industry is that when we talk about the circular economy or getting things recycled or composting things, it requires everybody to get involved. You can't just have governments do one thing and then people and citizens do another and businesses do something entirely different. You need something that works for everybody because waste is indicative of behavior and it tells a story. So what we try and build here at Scrap is a common data platform that engages people, producers, and businesses all alike so they can work towards that common goal. And that does include hospitals as well. I will keep this section very brief, but essentially we build
Those
technology.
are the people that are on.
Yeah.
We create
Am I
technology
muted?
in terms of different aspects of waste. So, brands and retailers, individuals, businesses, or municipalities, we build different technology for each of them so then they can all cross communicate and work together for the same goal. So I just wanted to start with what is zero waste. So as far as zero waste goes, it's the conservation of all resources by means of responsible production, consumption, reuse, and recovery of products, packaging, and materials without burning and no discharges to land, water, or air that threaten the environment or human health. What that is basically boils down to is one of the people on the board with me at CSWS likes to say is you can't burn it, you can't bury it. You have to do something with it and give it some higher use or purpose. So if you need to learn about zero waste, don't burn, don't bury. You're 80% of the way there. And lastly, right here, we have the zero waste hierarchy. So when we talk about zero waste, not all methods are created equal. Recycling is fantastic, but it's actually considered a downstream solution, not an upstream solution. So I love recycling just as much as the next guy. But when you're trying to get rid of waste or reduce waste, recycling is a great place to start. But even a better place to start is to look at the source and understand if you're throwing away 10 pounds of food waste a week, maybe don't order as much food, and that would solve the issue instead of getting a bigger bin. So it's really changing the way we think with prevention and reduction at the top, and then reuse at the center, where, reusable packaging, um, reusing a tea bag if you like to drink tea, things like that, and those concepts. And then you have recycling as kind of the last bastion to recover things before you get into energy recovery and then landfilling something. And landfills are not innately bad. I think they're overused. I think that is the issue. But before we had landfills, we just dumped things into the natural environment. So landfills, although they are far from perfect, they still play an essential part into reducing waste, where we have safe places to bring things, pending that they are sited properly and have proper environmental testing. So, why care about zero waste? It's not just a thing for hippies and very environmentally passionate people like myself. It saves money. Landfill fees are very expensive, especially here in New England. Nobody likes waste. It's actually a very bipartisan issue. Nobody wants to fill landfills. They'd rather have materials see a higher purpose as it's economically viable to recycle and use recycled materials. Um, it's a good mitigation strategy as well. Wasting resources is never good for the environment. It also reduces regulatory burden when you go zero waste because you're having to manage less assets and liabilities in that way. And lastly, from a business perspective, it boosts brand image. They actually did a study on individuals, and someone was deemed more desirable as a partner in a romantic relationship if they recycled. So, from an organizational, institutional level down to the individual level, like recycling is a desired trait when you look at something, look at someone or a business to do business with, because it means they care at a deeper level past themselves. And then lastly, efficiency. Zero waste really is all about efficiency. It's how you optimize processes. It's how you look at things to make sure you're recovering as much material as possible. I don't know if people track markets like myself in terms of recycling markets, but copper is above $5 a pound. So it's the highest it's been in a long, long time. So recycling is a very important, and also just zero waste in general is a very important thing. And ironically, Clark D. Rockefeller actually made his part of his fortune through a waste product. Does anybody know what that waste product is? It's a byproduct of oil, and you've all probably seen it, used it. It's that prolific through society. Any trivia buffs can put it in the chat. I'll give you the answer in 10 seconds. Yeah, one of Reinmar's students or Reinmar is correct. It is petroleum jelly. It's Vaseline. Vaseline is a byproduct of oil that it's not, you can't put it in an engine naturally, but it's a byproduct that he managed to turn into a skincare product everybody uses. So before I jump into the hospital and medical side of this presentation, are there any questions for me about my background? Any other recycling or zero waste trivia people would be curious about? Going once, going twice, sold. All right, let's jump to hospital waste. So in the United States, hospitals generate between 9.74 and 33.4 pounds of waste per bed per day. Most hospitals and mid-sized hospitals around 400 beds. So you can imagine how that adds up very quickly. Obviously, the reason they generate that much waste is there's levels of hygienic standards of care. My girlfriend is a pediatric nurse, and the amount she gets sick relative to me, even with protective gear, like I can only imagine if she did not have protective gear on with these situations. So, by no means in this presentation am I saying hospitals are being wasteful necessarily. It's about modifying practices. And with recycling rates at around 21% for residential packaging in the residential recycling rate, we're running out of landfill space. And there's a lot of contention even citing a new landfill in New Hampshire, as we should be investing in other technologies anyway. So we're not going to be able to bury our way out of this one. We kind of got to dig ourselves out of the situation and really focus on reduction strategies and also recycling strategies as well. So to classify the different types of waste in a hospital, there's your standard office and administrative waste. This is about 75 to 85% of like the non-medical side of the hospital of the waste stream. Similar to what you would see at any office building or any household, people bringing in lunch, alongside like office paper, faxes. Granted, faxes are now going away, but the waste stream is largely categorized this way, and this is non-hazardous waste. Just because waste comes from a hospital does not immediately classify it as hazardous. I know during COVID that kind of changed quite a lot, but in current standards, if it comes from the office, it's fine. It's just normal waste stream. The next biggest area is food waste. So you're looking at your cafeteria waste, leftover patient meals, um, and also due to strict food safety standards, single-use packaging is common. Like I'm pretty sure we've all seen the ice chips in the styrofoam cup or things like this. Sustainable procurement policies really aren't top of mind for hospitals currently. So it needs to be whenever implementing zero waste, it has to be seamless and you have to really reduce friction with decision makers and really justify the decision, not just environmentally, but economically at the same time. And then lastly, the other area for the general waste stream and general like just recycling stream is packaging waste in the public area. So this is like your lobbies, your waiting rooms, things like this. Pretty similar to the office and admin waste side of things, maybe just a little bit more variable because that's where people are coming in and out of, both workers at the hospital and then patients at the same time. So now we'll jump into the medical waste side of things. And I actually did forget to mention these factors contribute to around 105,000 to $200,000 per year for every 300 beds at a hospital. So this is quite a large bottom line item. And this doesn't account for a majority of the spend for these hospitals. You'll see for medical waste, that number is around 350K to 600K per year. It's about 50 to 60% of the waste management spend, and it's 15 to 25% of the hospital waste stream. So even though it's a minority of the stream, it represents a huge amount of the bill. And we'll get into why each of these different types of medical waste causes that spike in cost. So infectious waste, these are materials that are contaminated by blood or other bodily fluids, cultures, stocks of infectious agents, these different types of things. Naturally, given I think we've all realized how disease can spread after the past 5 years, these have to be handled with care. The challenge actually comes with infectious waste is that one, you need safe disposal, but also nurses are trained when in doubt, include it. So if the gown has to be included with the infectious waste, is it just whatever the patient touched? Like what that barrier is as to what is officially classified as infectious or hazardous or medical waste, that's a very gray area. So a lot of the fees that companies or hospitals are paying is because nurses are, which is good to act in caution, but they're throwing away more into the medical waste stream than could actually just be classified as general waste or general recycling. And so luckily, Sharps is a bit more straightforward. I think we're all familiar with Sharps containers. We've probably all seen them in public bathrooms or at the hospital. These don't suffer from that same issue where a Sharp is a Sharp, but the box it came in is not classified as a Sharp, so that can just go into the regular stream. And then lastly, we have pathological waste. This is similar to infectious waste. It does have to be handled with care, especially depending on the type of disease or ailment the patient might be facing. So now jumping to pharmaceutical waste. This is actually quite interesting. So pharmaceutical waste, you cannot flush medication. It has to be disposed of properly, because now they're finding, even through sophisticated facilities like Deer Island in Boston, that the medicines and prescriptions and vitamins that we all take bioaccumulate in our bodies, and then, like, we go to the bathroom or we flush, like, leftover medication down the toilet, that will accumulate in the water supply. So medications, especially prescription opioid, these types of things need to be disposed of at a different location. But inside a hospital, they have areas for that. So pharmaceutical waste has to be treated with a different level of care as well. The nice thing with this is it's straightforward for the nurse to understand. The pill bottle goes with the medication, just for convenience, but in theory, the packaging is largely inert in terms of the medicine, so you could dump the medicine into the amnesty or bin or disposal area. Chemical waste is more laboratory reagents, disinfectants, solvents, and heavy metals like mercury. So these different chemical wastes, we'll get into how they can be handled a little bit later. And then we have radioactive waste, which we can imagine radioactive waste. This is often from like chemotherapy treatments, radiation therapy. These need to be handled in an entirely different way than other parts of the medical waste stream due to their volatility. So, in total, for every 300 beds at the average hospital, they are looking to spend around 700K to $1 million per year. Um, 50 to 60% of that is on hazardous waste disposal, about 15 to 20% of that is on general waste disposal, 10 to 15% is on labor and training, 10% on equipment and supplies, and lastly, 5 to 10% on compliance and administrative costs. Because it doesn't stop once something's in the bin, you have to arrange for a contractor, somebody has to manage that waste stream, any education or training around it for, safe disposal of sharps and these types of things. There's just a general upkeep cost with this. And really, the best way for hospitals to really understand their waste stream is look at their procurement, because waste is what's left of procurement. So obviously, you can do waste audits and analyses, but with hospitals, you can't always do that because of the types of the waste streams, whether the waste is radioactive, biohazard, or any of these types of things. Nobody's going to reach into a medical waste bin for an audit. So you have to look further ahead and kind of predict what's going to happen to it through visual assessments. So, rules and regulations of medical waste. There's a lot, as you can imagine. Hospitals are pretty tightly regulated in most regards relative to other types of waste. Um, I've heard stories of, we do work in the UK, and there are people who will collect contaminated soils, and they'll go to the landfill and then say it's not contaminated and dump it in the landfill. You really can't get away with that on the medical waste side. There's a certain level of robustness that's required. So there's a lot of reporting around hospital waste and the types of things that are going out and making sure they're disposed of responsibly, especially post 2020, 2021. Right now, waste management is incredibly expensive, especially in New England. We are very short on landfill space. Actually, Stericycle, one of the largest medical waste companies, was just acquired for 7.2 billion by WM. So it's a very profitable business for haulers because it takes a lot of equipment to be able to handle these things properly. Um, but from the business perspective, in terms of people getting, and hospital perspective, the more circular you can make your business and properly manage your waste streams, like, you could save up to 50% on your waste bill just by handling things properly and not overthrowing things away into the medical waste bin. And it's a good investment, as a circular economy model could save 50% of all human-made greenhouse gas emissions by keeping materials in the loop. So every item that is thrown away is a financial and physical waste. So using things to their highest purpose is really the goal. If there's glass vials at the end of the day from vaccine waste that can't be recycled due to coming in contact with any type of vaccine or medication, that's okay, because when you look at it the perspective of keeping somebody less sick, makes it so that they don't need a hospital visit and you're saving waste that way. So it's best not to stress the really small aspects, but to look at things really holistically and then look at behavior and then modify from there and reduce waste from that perspective as a whole. That's the start of zero waste, is really looking at what's wasteful, what is affecting the bottom line, and what's creating a lot of physical waste and addressing it from there. So as far as infrastructure goes on the waste management side of things, it's changed quite a lot in the past 10 years, and it's going to change a lot more in the next 10. So there'll be about 30.8 billion in terms of economic benefits over the next 10 years from waste management infrastructure. The sorting accuracy at a modern MRF, so this is more for your general waste stream in a hospital, operates at around 73 to 99% accuracy, with the EPA recently granting $275 million in funding through the Swiffer program, um, pending new administration stuff. There are over 300 plus material recovery facilities in the United States. So there are facilities that can process material. And there's about 6,800 plus organic waste processing facilities, ranging from compost yard piles to anaerobic digestion. So in terms of food waste collection and recovery, that there are certainly opportunities there and people willing to take the material. So hospital cafeterias definitely have significant opportunity to reduce their tonnage being sent to landfill there. Um, but the industry is expecting it'll need about 17 billion dollars of investment over the next 5 years. So in terms of the approach to zero waste, in a fast-paced critical environment like a hospital, human-centered design is going to be really important when you address a zero waste issue. We like to just call it around the office decrease friction rather than increase fuel, because if you put too much fuel on a fire, it'll blow up in your face. But if you can reduce friction, you can create a lot more opportunities that way. So, as far as looking at what initiatives you'll want to tackle first, really rank them, especially in a hospital setting, by ROI and political will. So, looking at, the political will perspective, hospitals, their number one priority is saving lives and treating patients. If you might have an opportunity that could increase return, like provide a large return on investment, but if it complicates it for staff, you're probably going to need to look at an opportunity that has less friction attached to it, where people can rally and get behind it, but at the same time provide a small win. So you really have to balance reality in a hospital setting as to what's going to agree with most people. So figure out the midpoint of the presentation. So does anybody know what the photo on the right, what movie that is from? Just trying to keep people awake at dinner time on a Thursday. So Office Space. Yeah. Your class or you are doing very well, Raymar. Yes, Office Space. The reason I loop in this movie is a really great scene, but basically he's a middle manager that constantly pesters the employees about something somebody else already told them to do like 2 minutes before. So you don't want to be that guy when trying to address office and administrative waste. There's tasteful, better ways to do it that can get people really involved. Yeah, class is on fire. Good for y'all. So as we mentioned before, the office and admin waste is about 75 to 85% of the waste stream on the non-medical side. Implementation of electronic medical records can reduce the amount of paper in the stream like dramatically. So in 2008, most of the paper stream was office paper. Now it's all packaging now. So email and technology has provided a lot of change to this environment. Um, in terms of true zero waste standards, actually defaulting to double-sided printing is you can receive points towards your zero waste certification for that because you effectively halved the amount of paper needed. And I think people these days are pretty used to just flipping to the backside. Printers, pretty much all printers can do it now. So it's a pretty frictionless thing to do. Um, Toner and ink cartridge recycling. I'm sure we all know Staples will pay you for the ink cartridges if you bring them back. As you can imagine, with the amount of printing a hospital does, the amount of money they would receive for their cartridges is pretty lucrative there. Clear signage and employee education, that's always a given. But another big two are sustainable purchasing and then e-waste management. Electronic waste collection, you can make money off of that, off of the e-waste, especially with the amount of monitors and electronic medical devices. A lot of these can go out for repair, and they'll give those medical devices to hospitals that might only be able to afford used equipment. Um, and then this way, e-waste is very emission intensive as well when it goes to a landfill. So by recovering those precious metals and those materials, you're preventing a lot of emissions later down happening, or even better, repairing medical equipment. That's the highest use case on that zero waste hierarchy. Lastly, in terms of sustainable purchasing, this is a good opportunity for hospitals to really assess the things they can control and how making swaps upstream where it won't even affect the staff, where switching from styrofoam cups to PET cups, for example, that alone turns an unrecyclable material stream into something that is recyclable. So very simple swaps like that that don't even affect patient experience or nurse operations. Those are the things that you can look at from a purchasing perspective. So, as far as food waste goes, again, sustainable purchasing, knowing how much food waste is being created, as well as food rescue programs. Granted, in hospital settings, this can be tricky because of the nature of a hospital, but I'm sure at the back of a cafeteria it is exempt from some of those rules, where a lot of schools now are implementing food rescue programs and bringing any leftover food to either homeless shelters, food banks, these different types of things, to really boost the highest use of food because personally I vermicompost, so I have a worm bin that I feed all my like fruit scraps and everything like that. But ideally, if you could feed somebody with something before feeding worms, that's kind of the ideal. And then food waste recovery programs. So these are your compostings and things like this. These types of things can prevent 25 to 45% less food waste sent to landfill. And food waste is very heavy, so this does affect your overall tonnage that you're paying. Um, at the same time, you're reducing your annual food waste and procurement spend by around $100,000 a year. So it can pay for itself very quickly. So I mentioned the zero waste hierarchy. The zero waste community just loves their inverse pyramids and tier lists. But basically, for the hierarchy for food waste, at the very top, you have source reduction, which is the most preferred thing. And then underneath that, you have like your edible food rescue. So giving Dunkin' Donuts, giving their donuts at the end of the day to a homeless shelter. They don't do that. There are very weird rules around it. We don't know why, but that's better than composting the donuts, for example. Then you get into all different kinds of composting, and then the worst thing that can happen is landfill or incineration in terms of food waste recovery. So I'm just gonna grab water. Any questions so far? I feel I'm a little bit rapid fire here, but we're with a good group, so I'm happy to stop and answer any questions if there are some. Perfect. Happy to keep going. So as far as infectious waste goes, many hospitals routinely dispose like around 50 to 70% of their waste as regulated medical waste, although studies by the CDC suggest that only 3 to 5% of hospital waste truly needs to be disposed of as infectious waste. So this is the big one. If you're reducing your stream that's going to medical waste disposal versus general waste disposal by 45% or even 65%, that is a massive cost saving. And obviously, I don't want to put out any blanket statements because every situation is unique. And I do not specialize specifically in deeming what is or is not hazardous because there's so many rules and regulations. But this disposal cost can be 7 to 10 times more expensive from medical versus general waste. So this is a really big opportunity for hospitals to pursue. And I know they're thinking, how are we going to reduce it by 65%? If you reduce it by 10%, that's a big win. So zero waste is very iterative and it requires a lot of different approaches. And this can come down to strategic container placement. Obviously, if a doctor's in a rush coming out of, an operating theater or, moving from patient to patient, if especially in an ICU. My girlfriend's a pediatric nurse. Her mom is an ER nurse. Things got to be quick. So you have to really be mindful of bin placement as well as staff education. So when they're making those split second decisions, it's just second nature. So looking at what bins things can go into. And then also making sure those bins are as available as the general waste bins. So for pathological waste, this has to be incinerated. So it has to be not just like, incinerated, but it has to go through a pretty in-depth process to make sure all pathogens are terminated. Is the problem with pathogenic waste is or pathological waste is usually 70 to 90% water. So from a weight perspective, you're dealing with a lot of water weight, which means that you're getting billed a lot from the hauler versus if it was dry or dehydrated, you'd be able to you'd be able to reduce the amount you're paying because you pay for waste by the ton or by the pound. So this would be able to reduce quite a lot of the spend. So zero waste, this is a challenge for this waste stream because you don't really want to throw the baby out with the bathwater with this kind of thing, where, risking a pathological outbreak. I think we're all a little tired after the last one, so you want to be very careful with these types of things. Pharmaceutical waste, as I alluded to a little bit earlier, between 5 to 10% of pharmaceutical waste is considered hazardous waste by the EPA, with classifications depending on the type of medications, chemical properties. States may regulate different pharmaceuticals differently, while the remaining 90 to 95% is non-hazardous. But it still requires proper management as it can contain active pharmaceutical ingredients that may harm the environment if improperly disposed of. So, this comes down to like waterways where you don't want to really mix two different medications that God knows when it gets all mixed together. That's the risk that they're really looking at when they provide this kind of advice. But at the end of the day, there are specialty bins in specialty zones, usually at police stations, pharmacies, and even inside like hospitals where they can segregate pharmaceutical waste and medication with these types of zones, where pill bottles and boxes and these different types of things, making sure that the recycling stations are all set up so that there is packaging recycling directly next to medical or pharmaceutical recycling. You could ensure that the packaging is not ending up in that stream because the Advil bottle probably weighs more than the entire amount of Advil inside the bottle. So if you could reduce your tonnage by half on pharmaceutical waste, that's a win. You know? So chemical waste. This is probably the most challenging one and very case by case. This is your laboratory reagents, disinfectants, solvents, and heavy metals. So chemical inventory management systems are really the best way to manage this because if you do have, um, if you do have chemicals left over from any specific process, you're going to want to look at making sure you understand where you got the chemicals from because a lot of these companies will take the chemicals back as they can reprocess them and reuse them. Beauty is very much in the eye of the beholder when it comes to waste. On the packaging side of things, we use something called regrind, where basically any waste from the manufacturing process, we put it that is maybe a reject or the package didn't come out right. We regrind it right on site back into flake and then remake the package again to make sure it comes out right. Obviously, a chemical process is much more sophisticated than that, but to them, they're chemists, they're scientists, they know how to make it work, and they'll probably take back anything unused and either refresh it or it might still be good to be used, where to a hospital, it's just waste at that point. And obviously, proper chemical handling and waste reduction techniques are very important in this situation. So really, the only option for chemical waste really is looking at procurement assessments and assessing where the chemical waste came from and if they're willing to take it back. Radioactive waste. This is a fun one. I did have to educate myself on this leading up to this. There are special programs called decay in storage programs. So these are short-lived isotopes like, TC99M and I-131. Do not ask me which of those two are. But these are basically you want to use dose calibration and planning software to really minimize the you know, amount of waste that's going to be left over at the end of the day. This again really does come down to sustainable procurement. And at the end of the day, these are parts of people's treatment for very serious illnesses. So this really typically isn't the focus in terms of a zero waste assessment for a hospital. But the biggest thing is employee training on safe disposal and procedure, because the last thing you would want is this ending up in the general waste bin. So to close this out, a little bit more inside my domain is we actually work with a company called SnapSlide. So there's a link here. I'm not going to play the video, but feel free to check out their website. It's actually pretty cool. So what they've done is that they've made a pill bottle that, you know how getting them open when they're child safe is like impossible, especially if somebody has arthritis, like these things are very difficult. They made a closure, so a cap that is actually able to be not tamper proof under the age of 5. And anybody can just press their thumb on it and slide it forward. So this specific motion, you don't develop that till after 5. Never would have known that until I met Jason. But essentially, what this does is it reduces plastic by about 60% relative to traditional caps, and it's openable by people that are even double amputees. So there are ways that this can be opened where when we think about somebody's uh, level of care they might require. Sometimes, with the elderly or people that are chronically ill, somebody has to come over and give them their medication because they cannot get the pill bottles open. And you can't just leave pill bottles open everywhere and these types of things because you have to measure and count pills. With this, people that are able to administer their own medicine now can, regardless of any physical disabilities, because it's so easy to open the top of the closure. So when you look at zero waste strategies, you're looking at ways to optimize people's lives and make things better and make things easier through human-centered design. Um, but as far as that goes, that's about it. So just wanted to wrap up here. If there's any questions, happy to discuss and feel free to let me know. I will answer anything and everything. I'm a pretty open book. I think I just saw Paul in the chat. So he knows I'm a very open book. Oh, Mary, I can't hear. You're muted.
Mary, you're muted.
Okay, can you hear me now?
Yes, yes, I can.
So the question is, there are many reasons why the US has a hard time pursuing a zero waste circular economy. Linear economy dominate, lack of recycling infrastructure. At some point, the cost is going to catch up to the US. What needs to happen to change our behavior? Do we need to keep hammering on the econ and health benefits of a zero waste circular economy?
Hmm. So there's a lot there. So oddly enough, tariffs, especially to China currently, as questionable as they are, and tariffs globally in general, that severely messes up the recycled commodities market. Because if you get hit every time you move offshore and onshore, originally, so there was a problem back in 2017, 2018, where China enacted national sword. So we used to ship all of our waste to China to the point where but it got so contaminated that China said, we're just not going to take it anymore. And corrugated cardboard prices actually went negative. So corrugated cardboard prices are actually the index that is used by industry to track consumer spending. So you can actually, the corrugated industry was able to tell that a recession was coming in 2008 because their box sales had declined so rapidly because the purchasing power just wasn't there. So when we look at recycled material markets, they're very indicative of economic health as a whole. So when we put tariffs on these things, it's going to shake up the way we procure our materials. We'll almost be forced to process material domestically. And this actually prompted in 2008 and even in 2018 when China said no in 2008 after the recession, where corrugated cardboard and recycled fiber was so cheap, a lot of domestic production was actually built. So when we discuss going zero waste for the United States, New England is pretty rapidly pursuing it currently. I know New Hampshire is a little bit of an exception, but I know Forest Lake is under a lot of debate at the current moment. So with this, nobody wants a new landfill, and then they're too expensive to build, and even then there's leachate that's a problem. So from a common sense perspective, a lot of politicians are wising up, and a lot of just the general public is recycling is our best option in terms of saving money because landfill space, if you want to think from the Wolf of Wall Street perspective, supply and demand, as landfill space shrinks, tipping fees get higher, and it's proportional to the amount of space. So if there is 1% landfill space left, you are paying 99% more than you were when it was only 1% full. So with these things, it's reaching to the point where a lot of waste in New England is actually being shipped by rail to Ohio because it's cheaper than burying it here. So there's just a certain point where we'll reach a real boiling point where we can't keep putting things in landfills and we have to divert in other ways. Um, and I do think um, the cost will catch up to us pretty soon, especially with microplastics legislation that's coming out, as well as EPR. And EPR stands for Extended Producer Responsibility, where if I produce, I got Tom's of Maine here. If I produce, I'm guessing 40 grams of plastic in this applicator, for every gram of plastic I produce and make and send out to the retail shelf, I have to pay a fee on that as Tom's of Maine. I have to pay that. So there, I could do a whole thing on EPR, but basically the policy is changing. Economics aren't working out to keep burying things. Nobody wants new landfills built, especially as the sorting technology is getting even better, where it's more cost effective to run recycling facilities. And then I think the biggest thing that really needs to happen is the success of these initial programs. So I think once one state cracks it and does it well, the fees that are collected from things like EPR for, the deodorant applicator, the plastic bottle, goes directly into funding solid waste infrastructure. So I think that will really start where we'll start to really see that seismic shift to, I don't think it'll be a slow growth. I think it'll be rapid and really quick because we're starting to see states that are doing well with it and diverting more material and they're creating jobs at the same time. So that was my very long-winded answer to Paul's very detailed question.
So, a question from Reimar is well, several questions. Do you see any practicality in using glass instead of plastic in the way it was before plastic? And a question that Reimar also has is what are the best organized recycling industries? What countries, any hospitals in the US that are, any states that are ahead of others?
Hmm. So I'll do the second question first. So in terms of what countries have the best organized recycling industries, it skin like Sweden, Norway, Finland, they do incredibly well. They are fans of incineration, but if you actually put out your wrong, if you use the wrong colored twine to bundle your cardboard in Switzerland, you get a fine. So they took a entirely different approach through cultural lens. So I'm gonna have to back up for a second. It entirely depends on the culture that you're talking about. Recycling is a very cultural habit. Best recyclers in the world by culture, Japan. Japan, they don't even have public trash bins. Everybody carries the trash they generate with them and then disposes of it in 7 different bins at home. They have a deep sense of personal responsibility as a culture. And on top of that, they have a very communal collectivist culture. The more collectivist the culture is versus individualist, typically the better recyclers that they are. So this also carries over to Switzerland and Sweden, where the collectivism isn't as strong, but they're very rigid with rule-making processes. And this is true for Germany as well. So with these types of countries, they perform really well. In terms of countries that are terrible at it, um, Africa struggles for a very different reason because of just lack of infrastructure. The United States sucks because we're lazy and we don't want to do it, and we're a culture of convenience. So, and also a rampantly individualist society. So, the second we see somebody else not doing something, we will proceed to not do it. And also, with the way recycling was kind of handled in the United States, a lot of waste was being shipped overseas saying it was getting recycled, and that just wasn't happening. And the industry never really owned up to say, like, we're sorry. So a lot of people never really, they still think it all goes in the trash. It doesn't. Things actually do get recycled the second they hit a MRF. Like once the trash is in recycling is picked up from the curb and brought to a facility, 83 to 99% of that gets sorted and sent off to be recycled into material. So if the receiver can catch the football, we've got a touchdown. But the passing sucks right now. And that's really our biggest issue as an industry, is as an industry, we can't take accountability for what we did in the past. And at the same time, we haven't been able to perfect the passing and getting the material to the right people. And that causes a lot of struggles in an individualist society like the United States. So best I would shout out Japan because it's an island nation. They have very big difficulties on the infrastructure side. But from a sortation perspective, their contamination rates are like very low. So that would help you to answer that question. Technologically, Scandinavian countries and Norway, Finland, Sweden, Switzerland, they do very, very well from an infrastructure side. Um, in terms of handling the plastic versus glass, that is a very difficult. So I've actually been doing a lot of research on microplastics currently for a client, and right now we're really dependent on expert opinion. So what we have found in lab results and testing is that the rate of transmission of microplastics through food, especially liquid contents in a plastic package, is a lot larger than we thought in certain regards. But at that same notion, you get more microplastics in your body from somebody breaking on their tires through airborne emissions than you would drinking from a plastic water bottle. So there's a lot of things going on with microplastics and plastic packaging. So in terms of from a medical perspective, if a nurse is dealing with a fussy child and drops the vaccine vial and smashes it on the floor, that's an issue with glass. But with plastic, that is not an issue. So for plastic versus glass, you would genuinely have to assess how reactive are the contents with the package themselves first. If they are non-reactive with the container, if the contents in the container are non-reactive to one another, plastic is probably the safer bet from a user perspective because that way we can ensure there's no breakage, it's lighter. That being said, if the unknowns about plastic are proven to be worse than initially marketed as, that flips the equation. So, given on the current non-peer reviewed, we're looking at kind of the expert opinion and initial data, it's a toss up. But if that skews to glass's favor, glass is safe. And I tell customers, especially in food and beverage packaging, all of the risk of glass is internalized. We know what it's going to do. It is heavy, it can break, but we don't have to worry about any leachate from the contents. But if we look at it from the plastic perspective, it's light, it's cheap to make, lower minimum order quantity when you're trying to order packaging. Challenge with that is there's a big if on, hey, we messed up with BPA and reduced men's sperm count by 67%. That was a little bit of a whoops. And that's only one bisphenol. There's 26, one for each letter, and they still use other bisphenols in certain jurisdictions. If that is the type of plastic we're talking about that is still using bisphenol H or F or G, that's a different conversation. But if we're using a bio-based polymer made from sugarcane that does not have toxic additives, that's an entirely different conversation. So it's a very big tent of plastics. So if it's the worst of the worst of plastic versus glass, take the glass. If it's the best of the best of plastic versus glass, maybe probably take the plastic. But there's a lot of ifs, and we're waiting for a lot more science to come out about it and how human bodies can work with plastics in general. That was my
Well,
second long answer. So
but it seems also that there's going to be a lot of financial pressure on hospitals and medical offices as the costs of things start going up. And Reimar's other question is what can a customer or individual, or I would say, what can a patient do to start raising awareness of this? And I think back, and I'm sure a lot of us do, especially to COVID, where suddenly it seemed there was so much waste. We were doing all the testing, and have we seen any patient movements or any really notable beginnings at trying to tackle this issue in hospitals and medical systems?
yeah, so medical systems are very tricky. So I have an autoimmune disease. I have to take a weekly injection. So like I owe plastic my daily function essentially. So there are certain things that are just non-negotiable for people, diabetics with insulin, and everybody has things that are just a hard no, like can't change. Um, So, what really starts with anybody, whether you're an individual or an organization, what are the things you can easily change and fix? Mine was food waste in my house because in the summer we all like to eat a lot of melons and these different types of things. So it had a lot of rinds. It wasn't that I was being wasteful, it's just we have a lot of fruit rinds. I created a vermicomposting bin in my garage and I have another one that's embedded in my garden. Easy way to reduce a lot of weight going to the landfill. Now, with other aspects in terms of a hospital, they really do have to look at what is the level of care being provided to a specific patient. You'd have to look at it in buckets, right? So you could look at, you know, for you probably immediately rule out all intensive care patients. That needs to be a separate category, and we're going to change that last. And I think from a patient perspective, you have to think about A, what is the type of care you would typically require? And then also B, are there opportunities to, use reusable containers where you can? Like the number one thing we can all do is a hospital might give you, plastic water bottles to drink from when you're in the hospital. Somebody can bring you a reusable water bottle and they can fill it in these different pending non-hyper infectious disease. So it really comes down to what are the easy swaps that you can make. And I know plastic straws are very overdone. I've always just drank out of the cup anyway and not used the straw. Like I think that's a very overdone argument, but it's what can you swap in your daily routine, in your daily regimen, that those little changes really do stack up. One of the other projects I've worked on is I did a year's worth of plastic with a director of a brand museum out in Chicago. I counted every single piece of plastic he produced for a year. It was over 4,500 pieces of plastic. I put them all through a near infrared spectrometer. I identified what type of resin it is. I did everything soup to nuts. I knew what product they were attached to. And when we have these conversations about reduction, what I noticed is the amount of apple juice bottles and coffee and creamer drinks, the amount of plastic from drink products accounted for over like 35% of his plastic footprint. It was a lot. And a lot of them were apple juice bottles. So when I'm thinking about, I'm like, okay, what's the deal with apple juice, and why are there two different brands in a very high volume? His daughter likes to start her day. Her name is Fion. She likes to start her day with grandpa juice. I don't think that is entirely appetizing by the way it sounds, but basically it is two different types of apple juice. It is simply apple and Indian summer apple juice mixed together, and that's how she starts her day. But if you don't give her apple juice, she will be upset. So when we're talking about reduction strategies for people, is it worth a screaming child and an upset child on the way to school? Or is it worth the plastic? We're not necessarily negotiating not having plastic, where people will be like, yeah, I'd take the glass bottle any day. Like glass bottles still pull the highest among people, despite glass having the highest CO2 emissions from an LCA perspective, because it gives a premium feel. It makes people feel differently. You would never catch Dior or a luxury perfume in a plastic bottle because the plastic would react with the perfume and alter the scent, but also gives a cheap feeling to it. So when we look at how we can change the way people feel about plastic, you have to really meet them with where they are and what's going to be the easy swap. Some people could be a vegan tomorrow and not have to worry about anything. I barely buy new clothes. Like Shein, don't need it. Like I buy new clothes once every 3 years when my stuff rips. Other people are a Maxinista and need to be on the latest trends, but they could be a vegan tomorrow. I'm probably not going to give up meat because with my autoimmune disease, it makes it very difficult for me to give up things. Plastic is kind of the same deal. With the things that you need to do are the things that are approachable to you. So you really need to assess what's going to be easiest for me to swap. Is it just a reusable water bottle to reduce plastic bottles there? Or is it from a hospital perspective, can we swap out any single use plastics that are non-recyclable first and foremost? Or can we switch our prescription bottles to something that's easier for the patient to open while at the same time you're reducing plastic usage by 67%? There's a lot of different things you can really do, and it comes down to what's most possible for you.
So then we have a couple other questions related to that. Um, is there any talk or any methods being developed to sterilize plastics? Or what about aluminum?
So for sterilizing plastics, this is very topical question. I was just reading about this today. Microplastics release in higher quantity after you've washed plastic toys or scrubbed plastic because you've damaged the structure to an extent. Plastics are also very volatile to UV. My first introduction was microplastics when I was in New Zealand. I lost my water bottle, so I was using an orange juice container as my water bottle in the field. New Zealand, for context, is inside the ozone hole, so you are dealing with the UV index of 14. They will not sell you sunblock under SPF 30 because it's ineffective. So I was wearing SPF 50 every day. I'm an olive-skinned Italian. I seldom burn, but the UV was so strong, it reduced the weight of my plastic bottle by half. It will degrade the plastic in real time. So I was just chugging microplastics, and my throat felt funny. I'm like, why? Like, dude, you're chugging microplastics. You got to throw that out. Like, that's a problem. So the more plastic gets interfaced with, the more it can flake. And this could be from UV, this could be from physical contact. Granted, more reusable style containers, they're structured a little bit differently. So we're learning how microplastics shed in that regard. But in terms of sterilizable plastics, they are very sterilizable when they're meant to be used in a reuse or sterile environment. They are not unsafe by any means. But if you're going to rinse out your plastic single-use water bottle, wasn't really meant for that purpose. So the use case and design case is entirely different. So sterilizing those plastics might be an entirely different conversation. I think we've all seen the Ziploc container that turns orange from having tomato sauce in it for too long. They are mildly porous, so they do react. So only sterilized plastics that were meant for a multi-use cycle. That would be my advice in that regard.
So, just as on the general level, there are models floating around from the risk insurers saying, yes, it's painful to make changes, but it's going to cost you a lot more if you don't make changes and think about climate change and adjust accordingly. Are there any models floating around yet that can be presented, say, to hospital or medical care system CFOs that say, look, this is what this hospital did and look how much money it's saving? Or
Yes.
is anybody developing those?
Yeah, the easiest way is waste tolerant voices. We swapped this for this and this for this, and this is the financial outcome. That's kind of the easiest thing currently. I think when we no, I wouldn't say overcomplicate, but for hospitals and organizations, like sustainability teams are strapped. Like all the people I work with have four different jobs inside the sustainability department, with between marketing, operations, package design, brand design. They need to be a little bit of a Swiss Army knife. The sooner you can cut to the chase and get to the point and prove the ROI or prove why it's a benefit to the brand, or the hospital, they're pretty quick to make the decision. But when they have to learn like the EcoVadis ISO 2000 29001 or circular economy standard 14,000 or 15,014 for circular economy, people's eyes glaze over. Not everybody likes to play in a pile of trash like me. I think I'm a little bit of an anomaly on that regard. But with hospitals, you really just got to tie it back to ROI, why these decisions are being made the same way. And this is true for sports stadiums too. A lot of sports stadiums are making their own material recovery facilities because the waste disposal costs are so high. So it's really just show a waste invoice, show how you can reduce that waste invoice. We'll test out the swaps and see the reduction in the bill. And that's kind of the proof in the pudding for these types of decision makers and really making a convincing argument and crafting that narrative and that storytelling. Because waste as an issue, it's not polarized at all. Like Republicans, Democrats, as extreme as you want to go, I don't think you could tell one person to say, "Hey, let's throw all our trash in the ocean." I think everybody would say, "No, let's not." So it's a pretty easy sell. And I saw I forgot to answer the question about aluminum. Aluminum is great. Aluminum cans have a plastic lining on the inside because the aluminum can't be touching the liquid. But in terms of so like look at Death to Plastic campaign is technically in violation of the FTC green guides because it does contain plastic, but because by weight an aluminum can is about 13 grams, the lining's like 0.25 grams, so it's inconsequential and relative to the package design in terms of weight and recyclable. Uh, Virgin aluminum, so aluminum that is not made from recycled content, consumes a lot of energy because to get aluminum bauxite to aluminum that is like processable requires an incredibly high smelting temperature, upwards of over 1,000 degrees Celsius, versus when you use recycled content, the amount of energy needed to take recycled aluminum into a can versus virgin aluminum into a can is 95% less. So recycled content aluminum, fantastic. And I think aluminum cans, when used correctly, phenomenal. But from an LCA perspective, using metal and mining ore is very carbon intensive from the get-go. But I think we'll start to see some reusable aluminum containers or reusable stainless steel. That's where I think the benefit is because it doesn't make sense for glass and aluminum. Those materials were never meant to be used as a single use case, and that's to their detriment. Versus plastic was, so it has the home field advantage. And until we really get the conclusion on microplastics and these types of studies around like the impacts of plastic, that's not going to be a level playing field for a while. So we're still going to see that tilt towards plastic because it's cheaper, supposedly less carbon intensive. Um, but I am a huge fan of aluminum cans. I think from a packaging design perspective, the way they feel, everybody knows the sound of an aluminum can opening, whether it's a beer or a soda, these different types of things. Like they have a nostalgic, iconic feel. So as a packaging nerd, love aluminum cans. Environmentalist, I like them too. It's just when we get down to the data and the details, you really got to be quite granular about stuff and really make informed trade-offs and decisions.
Well, we'll look for working examples for New Hampshire Healthy Climate as this happens, and we thank you very much for your time. I hope everyone who listened has some questions and can send them in, and we'll try to research answers. And good luck, Mikey.
Of course. Thank you so much. Thank you for having me tonight. I did post the link earlier. If you are an organization or a hospital and you need to know where to start for a zero waste assessment, we actually do like a free consultation, so you can ping me there. My email is Mikey@Scrap0, or you can reach out on the inquiries on the website. I'm the one who answers the emails, so you can find me there. But I hope
Thank
this
you,
was informative. I hope I didn't talk too fast. But appreciate everybody, taking time tonight. Appreciate it.
Mikey. Thank you very much. And we have been recording the session, so it'll be available for people to go back and refer to if they want. And we did see the link, and we'll share that out. So thank you
Awesome.
so much.
Thank you so much, John. Have a great night, everybody.
Bye.